Providers should be on high alert if their patient tests positive for Candida auris, and rightfully so. Candida auris can cause serious infections. In fact, more than 1 in 3 patients die within a month of being diagnosed with an invasive Candida auris infection. Once it is identified, it can be difficult to treat because it is often resistant to antifungal medications. Some are even resistant to all 3 classes of antifungal medications: azoles, echinocandins, and polyenes. Another concern with Candida auris is that it is difficult to identify. Candida auris can be misidentified as other types of fungi unless specialized laboratory equipment is used. Misidentification can lead to improper treatment and medical complications. The clinical presentation of Candida auris infections is similar to that of other Candida species. Infections that have been reported include but are not limited to bloodstream, urinary tract, gastrointestinal tract, and skin and soft tissue infections. The most challenging part of managing treatment of Candida auris infections is the level of drug resistance to the 3 main classes of antifungals. A recent publication describing antifungal resistance in the Mid-Atlantic region, shown here, estimated that 85% and 90% of Candida auris isolates were resistant to azoles and amphotericin B, respectively. Most Candida auris infections are managed on a case-by-case basis with the guidance of susceptibility testing. It is highly recommended to consult with an infectious disease specialist when caring for patients with Candida auris infection. It's also important to be aware of the testing capabilities of your lab to determine if samples need to be sent to special labs for correct identification. Antifungal susceptibility testing is critical when making a clinical treatment decision. If your lab does not perform antifungal susceptibility testing, you can coordinate testing through clinical reference laboratories or local or state public health departments. Once an individual becomes colonized with Candida auris, they are at risk of later developing an invasive Candida auris infection, with high morbidity and mortality rates. This is particularly true for those who have underlying medical conditions, who are immunocompromised and require complex care, who have invasive devices, who are on total parenteral nutrition, or TPN, who have been on a prolonged hospital stay, and residents of skilled nursing facilities. To prevent patients who are colonized with Candida auris from developing invasive Candida auris infections, it's important for clinicians to follow infection control practices. These include adherence to hand hygiene, as well as appropriate use of transmission-based precautions and diligent cleaning and disinfection of reusable patient care equipment. Clinicians must strictly adhere to recommended insertion and maintenance practices for invasive devices and meticulous care of tracheostomy sites to prevent infections from occurring. Invasive devices can serve as portals of entry for Candida auris into invasive body sites. As providers, you should continually assess the need for invasive devices and promptly remove them when they are no longer needed. By removing the portals of entry, you are minimizing the risk of colonization with Candida auris becoming an infection with Candida auris. Many patients with Candida auris infection or colonization may have received broad-spectrum antibiotics or antifungal medications prior to their positive Candida auris results. Assessing the appropriateness of antimicrobials and discontinuing them when not needed may help prevent Candida auris colonization and infection. Once Candida auris has been introduced into a facility, it can easily spread. Outbreaks have been reported at hospitals, nursing homes, and other healthcare settings. Healthcare facilities and providers in Pennsylvania should consider screening the following patients who are at high risk for Candida auris and placing them on preemptive contact precautions while awaiting test results. Healthcare contacts of those with newly identified Candida auris infection or colonization, and patients with clinical risk factors for Candida auris acquisition, like one or more of the following: patients who are on a mechanical ventilator or have a tracheostomy, and reside in or are transferred from a long-term acute care hospital or skilled nursing facility with the capability to care for residents on ventilators. Patients who have had an overnight stay in a healthcare facility outside of the United States within the last year. Patients infected or colonized with carbapenemase-producing carbapenem-resistant Enterobacterales, or CPCRE. Co-colonization of Candida auris with these organisms has been observed. When transferring a colonized or infected patient to another facility, notify the receiving facility of the patient's Candida auris status verbally and in writing so that they can implement infection control measures to prevent transmission. Use the Candida auris transfer letter provided by the Pennsylvania Department of Health as a cover sheet to communicate infection control measures. Also use an interfacility transfer form to assist in communication. An example from the CDC is shown here. Thank you for listening today. This video is part of a 10-part video series on Candida auris. To access additional videos, please visit the Candida auris video webpage at health.pa.gov/c-auris-video. For questions about Candida auris, please contact your local health department or call 1-877-PA-HEALTH.